Niramai is a is a startup. It's a company that has developed an innovative AI-driven diagnostic solution in the domain of breast cancer screening, which is used to detect breast cancers early. As part of our awareness initiative, because we believe that it's not just important to have a device, but also talk about how to detect breast cancer early, we have these monthly webinars. Our focus is, of course, breast cancer, but also breast health, because of which today we are here to talk about breastfeeding. Every year, April 1st to April 7th is celebrated as the Breastfeeding Week, and that is why we are here. But before we go on to a topic which will be spoken about by Dr. Sushmita, I will take you through what Niramai does and what Niramai does and why it does what it does. Uh, I think it's a well-known fact that breast cancer is one of the leading causes of cancer deaths in India. It is a leading cause of cancer. It's the most commonly diagnosed cancer as well throughout the world. In India alone, in 2020, we had 180,000 cases detected in India, and in the same year, we had 90,000 women succumb to the disease, which is, a uh, very skewed ratio, because after every two women who are detected from breast cancer, one woman succumbs to it. And is there a solution to stop or decrease the number of deaths? Yes, the solution is early detection. And when you detect breast cancer early, the chances of a prompt treatment is much more, and because of which survival rates are also better. You may all, so there are many reasons why women are not getting detected early. One of them, and the most important one, I think we believe, is lack of awareness, because of which we have these awareness sessions. Definitely accessibility for screening tests. We have all the important standard screening modalities in tier 1 and tier 2 cities. And hence there is a need for a portable and accessible test. The other issues are lack of qualified human resource. We might be able to take a mammogram to a village, but to have a radiologist in every village would be really difficult, because that's specialized. And thanks to COVID, we all know how burdened our healthcare system is. And of course, radiation and pain, which are associated with the standard imaging modalities. They also have a technological limitation, in the sense that there's no solution for screening women less than 45 years and with dense breast. And that is where thermolytics comes into the picture. It's a test that can detect cancer long before a lump is felt. Lump is usually the first sign of an abnormality in the breast. It's also a painless and a radiation-free test. It can be performed by a technician outside, the patient, so the participant or the lady is sitting inside this booth. There is no contact. It's completely privacy aware, and the report will be reviewed by a doctor. It's affordable. It's one-tenth the cost of the standard imaging modalities. It's portable. It's light. It's a small screening device. It can fit into a cabin baggage, and you can see it's a really small device. It's powered by machine learning, and it's applicable to women of all ages and men too. Because of its portable nature and the present situation, we did realize that not everybody can go and get themselves screened in a hospital because of COVID-related guidelines and lockdown, and which is why we have also bringing breast cancer now to at the comfort of your home. You can be at home, schedule an appointment, and get yourself a screen for breast cancer. Do not be worried by the word cancer. Your breast health, like any other part of your body, needs to be checked routinely, annually. And if you don't want to step out, we will come to you. With that, we can start off with our webinar series. We have Dr. K. Sushmita with us. Dr. Tanveen, I request you to introduce Dr. Sushmita.
Hi everyone. Hello, Dr. Sushmita. Welcome. So as an introduction, Dr. K. Sushmita is the director at Care Health, Hepal, and is also a consultant gynecologist at Cloud9 Hospitals, Bangalore. After obtaining her MBBS degree from Al Amin Medical College, she went on to obtain her DGO from MS Ramaya Medical College and DNB from St. Martha's, Bangalore. A member of the National Academy of Medical Sciences, she specializes in gestational diabetes mellitus and thyroid disorders in pregnancy. Today, she is with us to share her rich experience of over 20 years. So welcome, Dr. Sushmita. I'm sure this will be a great interactive webinar from here.
Thank you, Dr. Tanvi, for a warm welcome.
Sure.
Yeah, so as rightly Dr. Lakshmi said, the breast cancer is the most important, developing the cancer which can be detected early on, and 100%, almost a good care and a 5-year survival rate is shown to be the best when it is detected early. So, coming to understand the development of the breast, we need to know how the breast develops and what is important, why it is important to know why the examination of the breast plays the most important role in detecting the breast cancer at the earliest stage. Okay. So usually when we speak about the breast development, it develops from a ectodermal thickening from a mammary ridge. We call it as a milk line, that is a line of Schultz. Why I'm importantly stressing on this point is many of the women gets very often that worried when they feel a lump in the axillary region. So what they have to understand is the lump which is felt in the axillary region, we call it as a breast tail. Okay, breast tail. So you can skip this slide. Yeah. Yeah. So when we look at this picture, we will exactly know from our fetal development where and all the breast tissue can develop. So if you look at this mammary line, so exactly in the axillary region, both the sides, you have the breast tissue which can be felt palpable when they are active, and the lower lines, of course, they are not active in the uh, human population, but yes, in the animal population, few of the things we can see. So whenever we see a lump, there's no need to get worried about it. Apart from the breast, the lumps can be noticed in the axillary region. So these are nothing but the mammary tissue, what we feel. Next slide. So when it comes to when it comes to the breast development, of late, why I'm stressing this is the breast cancer is not pertaining to the older age group. We also see at a younger age group of late. So when the pubertal development of the breast tissue is happening, so we are seeing quite a bit early pubertal development at the age of 8 to 9 years of late. So which is very important because the estrogen exposure to the women has increased. That is a reason of the enhancement in the breast tissue which is happening. So as estrogen is getting more active, so we see a lot of glandular tissue being more prominent. So the fatty tissue, which is a palpable, which is constituent of most of the lumps, what we notice in the breast. This fatty tissue appears later, but initially, when we look at the breast development, it is a glandular tissue. So whenever there is a palpation of the breast, when we are doing it, the lot of lobularity what we feel on the hands, which many of us get confused whether there is a lump in the breast, that is the not the glandular tissue. It is something called cystic changes which happens at the fatty tissue. So when we are looking at the screening aspect of breast imaging, so these are the things what we have to keep in mind. what is the composition between the glandular tissue and the fatty tissue. So we can miss many of the times when there are huge breasts. When there are huge breasts, our detection rate in a palpable method, we can miss few of these findings. So that is why when Dr. Geeta, when she had told me about this, what they have, the screening, which is a very good tool to detect the ratio between the the vascularity and the hypervascular areas, where we can see the tissue which can that is a reactionary tissue which is there, which detects that yes, this breast has to be evaluated more often. So the next slide. When you look at this non-pregnant, pregnant, and lactation tissue, so when there is a non-pregnant status, when you look at the glandular tissue, the amount of glandular tissue is very less. So once the woman becomes pregnant and during lactation and later, so the glandular tissue, what we see is much more, and this is called as hypertrophy of the glandular tissue, what happens during pregnancy and lactation. So these are the things which we have to keep in mind during lactation. When we look at the screening of the breast, the amount of milk which the breast can be focused on, this breast is going to secrete more milk, and the left breast or the right breast, we can definitely detect with the element what Nirmai had invented. Okay, so this is one of the usefulness where we can definitely tell the woman that this breast is more potential, has a more potential for lactation. So you can feed the baby more on this side and less on this side, so that the lactation failure aspects can be identified before. Okay, the next slide. So all this is not needle. So the phases of lactation, when we look at, so one is mammogenesis, lactogenesis, and galactokinesis and galactopoiesis. So mammogenesis is the preparation of the milk. Lactogenesis is synthesis and secretion of the milk. Galactokinesis is expulsion of the milk, and galactopoiesis is maintenance of lactation. So when it comes to maintenance of the lactation and the synthesis and secretion of the milk, okay, so this is where we can identify how much is the amount of breast milk which is going to get secreted from a particular breast. So these are the things where we can evaluate the patient and tell that yes, her breastfeeding is more prominent on left or the right breast, so which can help them. Okay, the next slide.
There's a question in the chat, Dr. Sushmita. I thought it's relevant here. They're asking, when should a mother alternate breasts while breastfeeding? I thought it was relevant here because you were talking. So,
okay. So when we look, always there is a prominence of one breast, whether it is a left or a right, where the breast milk secretion is more at one side of the breast. So when you are looking at alternating, identify the breast which the milk is more, when the baby is more comfortable at feeding at one side of the breast. Alternate the breast every 2 hours, basically. Okay, but if you find out that the baby is more comfortable at one side of the breast, probably you can alternate every 2 hours at a lesser aspect on the breast which secretes less milk. So what does that mean is, if you try to feed the baby on the right side and you feel that baby is more comfortable on the right side, and the baby is taking a good amount of milk on the right side, and the milk secretion is more on the right side,
So alternate the other breast probably once in left once and right twice. So the lesser number of times on the left side and the more number of times on the right side. So every feed you try to alternate the breast, but more times to the side of the breast which secretes more milk. Okay.
Thank you. Thank you. I'll go to the next slide.
Yeah.
There are more questions in case if you want to take the questions, Dr. Sushmita, just let me know.
So the next what is important is the milk secretion, which many of the mother feels that, okay, I'm producing less milk, what should I do? So the main hormone which is related to the milk production is prolactin. And we have to more focus on sucking the baby more number of times in the night. When the baby is sucking less in the night times, the prolactin hormone is not maintained. That is where the milk secretion goes down, and always there is a deficiency of milk production. So what happens, why does this happen is, the prolactin is a more active in the night. So as the morning hours, the baby is fed well in the breast, and nights when everybody is agitated, that yeah, baby is not sleeping, or baby is troubling, and baby is not probably not getting enough milk. So they try to feed the external formula feeds. So that is the reason the baby stops sucking in the night, and over the time the prolactin hormone is not being maintained at a higher level, and hence there is no suckling reflex, and then the let down reflex which is created at the milk secretion point, that is the nipple. So this is the cycle which goes on, and the milk secretion comes down over the months. So what we have to understand is all the breastfeeding mothers concentrate on the night suckling. Minimum there should be a 4 to 5 times baby sucking at the night rather than more in the morning. So this is one point which I would like to stress on all the breastfeeding mothers. So next what we have to understand is about the how do you maintain the quantity of milk. So as soon as,
Should I go to the next slide, Dr. Sushmita?
yeah, please. Next slide. So I thought I will just maintain, this is one thing what I would. So what we have to understand is the first, as soon as the baby is born, whether the baby is born through a C-section or whether the baby is born through vaginal delivery, within 1 hour, the baby should have the sucking that is called as golden hour feeding. This is very, very important for the initiation of the breast milk. So the components of the breast milk, what we have to understand is the first 3 to 4 days, the milk which is secreted is called as colostrum, and it is not of much quantity. It is coming in a drops form, which is very yellowish, thicker, and always the mother feels that the milk is very low. But no, this is a very, very thick drops, which is more than enough to, satisfy the hunger of the baby. What we have to understand, it is very rich in antibodies, immunocomponent cells, and vitamin A, vitamin D, E, K, all these things. And the other habit of, feeding the baby with honey, and I've seen they also feed with sugar water. All this should be not encouraged. Then the next, the mature milk, that is, which starts from the 4th, usually there is a element of transitional milk, which is more watery, which starts at 3 to 4 days until 2 weeks, which is more watery. And even this doesn't look like more whitish like a milk, it looks more like a water. So they are also rich in immunoglobulin, and protein content decreases while the fat and the sugar content increases. Okay, so the next comes the mature milk, which follows the transitional milk. This milk is more thicker in it. I mean, it is more thinner and more water, but contains all the nutritional elements for optimal growth. So what mature milk produces, at a term it is different, and for a preterm person. For the preterm babies also, it is different. That is why when it comes to the best nutrition for the baby, what mother has to understand is the breast milk, which plays a most important and the vital role in the development of the baby, because it contains the appropriate elements which is required for that term, the term of the baby which the mother delivers, whether it is, let it be at a 28 weeks, let it be at a 34 weeks or a 37 weeks, it doesn't matter, but the milk which is produced is more than enough for the baby to help in its development, its growth, its mental development, and its immunity, which is very important. Okay, the next slide. So when we start a breast milk class, we always tell the mothers that there are two kinds of milk which comes. One is the fore milk and the hind milk. So always when we look at the time span which is required to complete a feeding, what is important is when you start feeding a baby from either of the breast, you have to start completely emptying one breast. That is because the fore milk, which is a milk which comes at the start of the breastfeeding, contains more of protein, sugar, vitamins and all, which is more watery, and it only takes care of the baby's thirst. It doesn't take care of the baby's hunger. So you have to continue feeding after that, and which next follows the hind milk, which comes later towards the end of the feed, and this is rich in fat and then provides more energy and gives a sense of satiety. So this is the hind milk which, satisfies the hunger of the baby, and the baby sleeps after taking a good feed. So how long you should breastfeed a baby? So the baby should be fed at least 25 minutes to 30 minutes at one go. There should not be alternating, in the same feed. So I have seen many mothers, what they do is they feed 10 minutes at one breast and the 10 minutes in the other breast. So what it happens is only the fore milk is going forward to the baby, and the baby is never satisfied with the hunger. So they keep crying, and the mother thinks my milk is not being sufficient. So continuation of the milk secretion is important. Fore milk and hind milk has to be completed to satisfy the satiety, that is a hunger of the baby, and baby goes to a good sleep. So completely evacuate one breast, and then next feed, when you do it after 2 hours, switch over to the other breast. This is called alternating the breast, because they think that you should alternate in the same feed. No, it should be completion from one breast and then alternate in the next feed. The next slide. Yeah, so as we all know, the benefits of breast milk is it has a appropriate amounts of carbohydrates, proteins. Carbs are more actually, proteins are less. And the main thing is, I just wanted, the main thing what we have to focus in this is most of the protein, though it is low, but what proteins the breast milk has is a lactoalbumin and lactoglobulin, which is very easily digested by the baby. So the baby doesn't have a colicky pain, doesn't have a flatulence, and what it does is it also has the amino acids which are mainly taurine and cysteine, which are necessary for a neurotransmission, that is a neurodevelopment, especially for preterm babies, when it is very essential for the neural development. This kind of proteins, this kind of amino acids doesn't, they are not present in your formula feeds or your cow milk and all. That is why when we look at the babies who are formula fed, they are more into the obesity side. They are more obese, and the studies say that they will have a less immune response also. So that is the reason always for forming a good bacteria, the breast milk, especially when it comes to gut immunity, when it comes to respiratory immunity, breast milk forms a very good element. Next slide. And water and electrolytes, the most important component of a breast milk is water. 88% of the breast milk has water in it. So what it does is, what you have to understand here is, whenever there is a postnatal mother, the most important is water intake. Water intake up to 3 liters minimum 3 liters per day is most important to maintain the uh, the quantity of milk. So whenever there is a less water intake, the breast milk becomes more thicker, and it is very difficult for the baby to suck. The next element is fats. The breast milk is rich in polyunsaturated fatty acid necessary for nervous development. It also contains omega-2 and omega-6 fatty acids. And of late, we have started adding DHA also in the antenatal period and also in the postnatal period, so that also helps in the nervous development. Next slide. Vitamins and minerals, the quantity and bioavailability of vitamins and minerals is sufficient to need the baby in the first 6 months of life. So the baby doesn't exactly need anything from outside for the first 6 months, because the exclusive breastfeeding which happens in the first 6 months is more than enough for the baby to sustain the development part when it comes to mental health, when it comes to immune health and the gut immunity. After 6 months, the weaning has to be encouraged. The next slide. Immunological superiority, as this has been a lot of research conducted on the immunogenicity which is transmitted from the breast milk. So the breast milk contains a number of protective factors, immunoglobulins, mainly secretory IgA. This secretory IgA is most important for the gut immunity. So there have lot of studies showed that the diarrhea part, the rotaviral diarrhea, and the wheezing part, the respiratory, recurrent fevers, recurrent diarrheal infections, all this can be cut down by exclusively breastfeeding. And the incidence of the respiratory illness and your diarrheal dehydration, all these are more common in the formula fed babies. So the benefits to the mother is breastfeeding soon after birth helps uterine involution, reducing the chance of postpartum hemorrhage. It also provides protection against pregnancy due to lactational amenorrhea. So I would like to stress one point here. The lactational amenorrhea, when we speak about, that is the period where the mother doesn't have the periods during feeding the baby. So in this point also, the more the mother feeds in the night, the more the mother is away from the periods. So this also prevents her from pregnancy. The less the baby feeds in the night, the earlier the mother gets the periods. The breastfeeding is most convenient and time saving. As we all know, it is more hygienic. It reduces the risk of cancer in the breast and ovary. Yeah, this is one important statement what I would stress on. So of late we are seeing less mothers opting for completely breastfeeding because of the work profile what they have. Though now the maternity leave has been extended to 6 months of the duration, but yes, the ease of giving a formula feed probably, and what the advertisements, lot of advertisement being shown. So, and yeah, the lack of support from the elders, more of nuclear families. So the exclusive breastfeeding, I somehow feel, is not happening 100%. There is a compromise on exclusive breastfeeding. So we have to educate the mother that exclusive breastfeeding is also one of the most important, can prevent a breast cancer, can prevent ovarian cancer, and recurrent pregnancy issues also it can prevent. The next slide. So these are the benefits of breastfeeding, good for the baby as well as for the mom. So the next. So these are few steps for a successful breastfeeding. This is more for the hospital because we have to make a written breastfeeding, train all the staffs, no formula feeds, and inform all the pregnant patients about the benefits, help the mother initiate. How do we initiate this? Within 1 hour, we start feeding and encourage the mother in the hospital to breastfeed every 2 hours. Show them few classes, take a few classes to explain the positions of the breastfeeding and all that. So next slide. Next slide. Yeah. So the positions are also very important when we look at breastfeeding because the position of the mother and the position of the baby, it can prevent to many of the breast discomforts what the mother can have during lactation. The next slide. So there are a lot of, the proper position, why it is important is they can end up having a sore nipples, they can end up having a cracked nipple. So this can cause lot of, next slide. This can cause lot of discomfort to the mother and hence the proper latching is important for a proper breastfeeding. So how do you ensure that there is a good latching? Is the mother and the baby should be in a comfortable position. That is very important. And there are a lot of positions which have been described. So one is a cradle method. One is a, the football method. One is a football method. So all the positions have been shown here. Next slide. So these are few things when we need to know how do a proper latching, what does that proper latching mean? So latching is most important because there should be a proper, the widening of the mouth of the baby, the whole area around the nipple should be taken into the mouth of the baby. And the baby should suck not the nipple, but the area which is beyond the nipple. So the baby's chin should touch the breast of the baby and it should be little tilted backwards so that the nose is not getting pressed. So the true position and the false position. Whenever the baby is in the true position, the baby gets enough milk. Okay. So the next slide. Yeah, these are the few signs of good attachment. The next slide. Yeah, so this is the correct position for feeding the baby. So this is called as good latching of the baby, which can prevent from many other mishaps. Results of poor attachment is painful nipples, damaged nipples, engorgement, baby unsatisfied and cries a lot, baby feeds frequently for a long time, decreased milk production, and baby fails to gain weight. So all these are related to poor latching technique. So latching is the most important thing what every mother immediately after delivery should learn, at least should make an attempt to learn. I know there are slow learners also, few babies takes at least 5-6 days, few babies take a week to learn, but yes, the constant attempt has to be there to put the baby to the proper latching method. So how do you know that the baby is getting enough milk? Is the baby sucks and swallows. So always that swallowing noise has to be heard. Suck, suck and swallow. This means the baby is always satisfied and getting enough milk. So baby cheeks are full and not hollow or retracted during suckling. Okay. So these are the various methods of breastfeeding. So these are the, and twins, as we say, yeah, these are the various methods: front cross, double football, football and cradle, and upright launch. So these are for twins. So simultaneously, the mother can feed the twins at the same time if they're comfortable. But yes, they can feed on alternate things also. Yeah, the contraindications are important. So there are not many contraindications for breastfeeding. So only when the mother is on any sedatives and any the baby has any inborn errors of metabolism, if the mother has active genital herpes, we generally don't allow the breastfeeding as well, and HIV infection and untreated, if she has a open tuberculosis and active herpes on the breast as well, and mothers on certain medications like anti-cancer therapy and radioactive, of course we don't allow them to feed, especially on methotrexate, all that we don't allow the mothers to feed the baby. So common problems in lactation. So I think I can take few questions from here because
Okay, so right, we have one question in the chat which asks, uh, "How do I know my baby is getting enough to satisfy the hunger?"
okay. So as I said, if the baby after a feed of 20 to 25 minutes, the baby goes to sleep for 2 to 3, minimum of at least 2 hours, baby is going to good sleep. Baby is passing urine at least minimum 6 times to 8 times in a day, and baby is gaining weight. Okay, and these are the ways where we can make out that the baby is getting enough milk.
There's one more question which asks, uh, sorry, how should the breast milk be pumped and stored?
Yeah. The breast milk can be, we have lot of pumps available, which are handheld pumps and electric pumps as well. There are different companies, Medela, you have a Pigeon company, you have a Johnson and Johnson company. So once you express the milk at the room temperature, you can save it for 6 to 8 hours. In refrigerator for 24 hours. So when the baby is, dependent on the mother who goes to work and all. So what we can do is easily we can express one 3 to 4 bottles of milk at a time, probably 30 ml to 60 ml, how much ever we are getting. So one by one, refrigerated milk also can be brought down to room temperature and fed. So there is no need to heat the milk or boil the milk or something. But as a common role, we don't encourage the mother to feed beyond the room temperature, and the expressed milk should not be left outside for more than 8 hours. So that is the maximum limit what we take, 6 to 8 hours.
Thank you, Dr. Sushmita. There's one more question which says, will both breasts have same amount of milk feeding capability or will they be different?
Definitely different, because one breast is always dominant than the other one. So whenever there is even you look at the development aspect, one breast is always bigger than the smaller. So the component of glandular tissue is more in one breast, and the number of glands are less on the other side. So one breast secretes more milk, that is called as dominant breast, and the other side it's always less.
Thank you. The other question is, can I continue breastfeeding if I'm pregnant?
Yeah, this situation we see of late, many of the times, in fact, when the mother is still breastfeeding and she conceives without her knowledge. So we continue the breastfeeding even if she's pregnant for a while. So not for too long, but for a while, to keep up a general health for the mother, because she will already have a deficiency of nutrients. So she has to take care of breastfeeding and also the growing fetus. So we try to ask them to wean off slowly from the breastfeeding. Probably she might take 1 month or 2 months, but yes, she should slowly stop the breastfeeding.
Thank you. The next question is, can pregnant women get breast cancer?
Uh, Yes. I see, one of my friend is a breast oncologist. So I was speaking to her. So what she said is the breast cancer is not uniform with age. We have also seen breast cancers in a younger age group. Why I'm specifying this is whenever we see a breast lump, this one point I wanted to tell you. Whenever we see a breast lump, it can look like a clinical examination, it can look like a benign thing, and we leave it. We tell, okay, get a breast scan done, and breast scan says that it shows a fibroadenoma, so we tell, okay, after delivery we'll see and all that. But even the fine needle aspiration, FNAC, what uh, we do it whenever there is a breast lump, can miss a breast cancer, can miss, because we don't know the depth of what cells are being taken out from the FNAC. So the latest modality is a gunshot biopsy. So the gunshot biopsy is more specific to the understanding what kind of cells a particular lump has. So even if she's breastfeeding, or even if she is pregnant, it is always better to take a gunshot biopsy and see the nature of the lesion. And we can definitely take a whole biopsy. So later we can,
Right.
after delivery, we can give her a chemotherapy. So that can be done.
Thank you, Dr. Sushmita. We have a question here, which is after how many months a C-section mother will get periods?
After
C-section, a cesarean section.
C-section. So 1 second.
Uh, Others can keep sending in your questions in the chat box. If you want it to be anonymous, you can always send it to me, and I will read out the question so it's not visible to everybody on the chat.
So when we speak about getting periods after C-section, it depends, as I said before, it depends on how long she's breastfeeding the baby, how many times she's breastfeeding the baby in the nights. Okay, and there is no particular time period or a time frame that these are the months or weeks that she will get her periods. So the initial what they have bleeding immediately after delivery and the C-section, it lasts for around 3 weeks. Okay, and later when the start of the period starts, it can range from immediately 4 weeks, it can range from 2 months, 6 months, 7 months, 8 months. So there is no timeline frame. So it depends on person to person and what kind of hormones um, the person has at that point of time.
I hope that answered your question. And we have another question, which is, are there certain types of food that breastfeeding women should take more? Do you have any dietary suggestions?
Mm, yeah. So actually, I had few slides on that, but I thought it was becoming very lengthier. So what I would
Okay.
explain orally. So main thing is 3 liters of liquids are more important when breastfeeding. And there are certain food what we recommend to the breastfeeding mothers. One is the methi, that is fenugreek. Fenugreek is supposed to increase the milk production, and few of the fenugreek leaves we can utilize. And fenugreek in any manner, in the sense they can soak it in water, they can make a powder out of it, or they can make it to all the seasonings they can put it. So any of the dals they can put, and they can have more of fenugreek. The other aspects of it is your uh, mm, we call it as the greens, which is called as dill leaves. Sapsige in Kannada we call it. That is also supposed to be increasing the milk secretion. And few of the smaller things like gond. This is something a powder form which is available, which is also good for milk secretion. And yeast is also known to increase the milk production. And basically the South Indians, they believe rice increases the milk secretion, and the North Indians, they believe at the anything which is made of wheat increases the milk secretion. So anyway, the basic uh, food, what is the rice and the wheat, makes the main constituent of breastfeeding. The and these are few of the galactogogues which you can add it.
Thank you. The next question is, do I need to wake my baby for feeding?
Yeah, of course. Well, every 2 hours, you should make an attempt to wake up the baby and feed. And in between, see, you cannot work like a clock that every 2 hours only you have to feed. But when baby is sleeping, definitely you have to wake up the baby. Maximum you can wait is 3 hours in a breastfeed babies. When it comes to formula feeds, they can hold on little longer. Up to 4 hours also they can hold on longer. And it can be a demand feeds also. So if your baby demands in between 2 hours, so it has to be a demand feeds as well, but minimum 2 hours you have to wake up the baby and feed.
Okay. The next question is, some women feed the baby for almost 24 months or so. Are there any disadvantages of long-term feeding?
According to the Indian Pediatrics Association, I mean, we are recommended to tell every breastfeeding mother that up to 2 years they can breastfeed the baby. But what, as an obstetrician, I look at is as soon as the baby reaches, probably a point of 1 year, 7 months, 1 year, 8 months, when they can sustain the other foods, it's very easy for weaning them from breastfeeding. So once they reach 2 years, they know everything, and it is very difficult for the mothers to forgo, immediately stop the breastfeeding. So as a pediatrician, yes, I understand they are concerned about the babies and breastfeeding, but as a obstetrician and as a mother, you know, it becomes very challenging to stop the breastfeeding at 2 years. That is 24 months. So I would suggest that there is just a gap of 1 year, 7 months, and 8 months where the baby can forget the breastfeeding. It's the best time to slowly stop the breastfeeding and then put the baby to other feeds.
Thank you. The next question is, can women with breast prosthetics feed babies?
Breast prosthetics is, see, basically they don't have a glandular tissue. So it depends on what is the amount of prosthesis they have undergone, amount of glandular tissue which is left. So if there is a milk secretion in that, yes, they can go ahead about feeding the baby. But hardly whoever has gone for a breast prosthesis, the amount of glandular tissue will be very less. So the amount of milk what is secreted will be very, very minimal to suffice the baby quench.
Uh, uh, I think this is the last question that we'll take, and it is, suppose I have fever, how do I know which medications I can take, and how do I know it will not affect my feed for the child?
So any fever, and the other
I
thing
think
is,
the question is probably they just want to know regarding medications which you can take. Yeah.
so whatever said and done, see, of late, why I'm telling you is because of this pandemic, everybody was confused whether can I feed my baby, can I feed my baby. In any conditions, when it is a fever or a mother is suffering from any sort of infections also, like urinary tract infection, or she has typhoid fever, unless and until they are put on a heavy antibiotics, so they can feed the baby, they can continue feeding the baby. Okay, there is no need to stop the feeding unless and until the medicines which are being recommended to the mother says that yes, these are the medicines which cannot be given in breastfeeding mothers.
Right.
Okay, and they can take a paracetamol. Paracetamol is quite safe in breastfeeding. So what is the dosage of paracetamol is they can go up to 3 times a day. They can take a paracetamol 650 mg. They can take 3 times a day and plenty of liquids, which will get down the temperature, and they can continue feeding every 2 hours.
Thank you, Dr. Sushmita. It was a very, very knowledge enriched 1 hour session. I'm sure we could go on and on, but I think we will close here. Thank you so much. I've learned a lot. Thank you so much, and I'm sure everybody else here would also echo my feelings. Thank you so much.
Thank you, thank you, thank you.
Um,
And
uh,
for giving me this opportunity, because yeah, the slides I was not I mean prepared though, so I could just
I think it was very insightful, Dr. Sushmita. Whatever you said, all of us, I think, I'm sure we learned a lot. Thank you.
sure. Thank you, thank you.
Thank you. Good evening, everybody. Have a happy weekend. Thank you so much for joining us.
Thank you, ma'am.